Hello everyone, I'm here to explain about the COVID-19 vaccine. But before explaining, I want to introduce myself first. Introduce, my name is Febriana and I major in public administration. COVID-19 vaccine. What is the COVID-19 vaccine? One of the main components of a vaccine is a antigen, a small inactivity or attenuated and harmless component of a disease-causing organism. These antigens play an important role in forming antibodies, which will be crucial part of our immune system. Why the vaccine? By following the COVID-19 vaccination, we not only save ourselves, but also protect to those who are vulnerable. Vaccination will also accelerate herd immunity when many people have been vaccinated. A combination now has herd immunity is format. This picture must be familiar to your ears, right? Herd immunity is a condition when the population in an area is already immune to a virus that causes disease. Herd immunity is achieved by protecting people from virus, namely by vaccination. There are several types of COVID-19 vaccine in Indonesia, namely Sinovac, Moderna, Pfizer, AstraZeneca. Sinovac vaccine explanation. The Sinovac vaccine was developed by Sinovac Biotech Ltd. This vaccine has passed the three phases of clinical trials conducted in Brazil, Turkey, and Indonesia. The three phase of clinical trial in Indonesia show with the vaccine efficacy value, namely the protective effect against COVID-19 of 65.3% Sinovac vaccine trademark coronavirus. What is the Sinovac vaccine? Group prescription drugs category COVID-19 vaccine benefits prevent SARS-CoV-2 virus infection used by adult Sinovac vaccine for pregnant and lactating women. The Sinovac vaccine can be given to pregnant and lactating women. For pregnant women, the administration can be started from the gestation age of over 12 weeks and at the last 30 weeks of gestation from of medications. Side effects and dangers of the Sinovac vaccine. Some of the side effects that can occur after receiving the COVID-19 vaccine are pain, redness, or swelling at the injecting site, fever, body feels tired, muscle itchy, nauseous, gag. Modern modern vaccine explanation. Modern Moderna vaccine has been approved for emergency use to prevent COVID-19 infection in adults over the age of 18 from clinical trials that have been carried out. These vaccines show an efficacy value, namely the protective effect against COVID-19 of 94.1%. What is Moderna vaccine? Group prescription drugs category COVID-19 vaccine benefits prevents infection with the SARS-CoV-2 virus used by adults. Moderna vaccine for pregnant and lactating women. Moderna vaccine can be given to pregnant and lactating women. For pregnant women, it can be administered from over 12 weeks of gestation and at least 33 weeks of gestation from of medical. Side effects and dangers of Moderna vaccine. Some of the side effects that can occur after receiving the Moderna vaccine are pain, swelling, or redness at the injection site, and fatigue, heat sweat, muscular ache, joint pain, shivering, nausea, and vomiting fever. The Pfizer vaccine is an mRNA or messenger RNA vaccine. This type of vaccine will trigger the immune system to form spike proteins, which will later help the body form antibodies that can fight coronavirus. Based on phase 3 clinical trials conducted in the United States, Germany, Turkey, South Africa, Brazil, and Argentina. The Pfizer vaccine has a efficacy value, namely a protective effect against COVID-19 of 95%. What is the Pfizer vaccine? Group prescriptive drugs category COVID-19 vaccine benefit preventing COVID-19 or SARS-CoV-2 virus infection used by adults and children over 12 years of age. Pfizer vaccine from pregnant and lactating women. Pfizer vaccine can be given to pregnant and lactating women. For pregnant women, the application can be start from gestational age of over 12 weeks and no later than 30, 33 weeks of gestation from of origination. Pfizer vaccine side effects and hazards. Some of the side effects that can occur after using the Pfizer vaccine are pain, redness, or swelling at the injection site, heat, itch, muscle pain or joint pain, shivering, mild fever, nausea, or feeling unwell, swelling in the lymph nodes. The AstraZeneca vaccine is derived from a genetically modified virus or viral vector. This vaccine works by stimulating or triggering the body to form antibodies that can fight infection with the SARS-CoV-2 virus. AstraZeneca vaccine for COVID-19 is undergoing clinical trials in the UK, Brazil, and South Africa. This vaccine has a effective health or protective effects against COVID-19 of 63.9%. AstraZeneca vaccine effect. Pain, warm, itching, or bruising at the injured site. Heat, body feel tight, muscle and joint pain, fever, diarrhea, shivering. Given to pregnant and lactating women. For pregnant women, It can be administered from over 12 weeks of gestation and at the latest 33 weeks of gestation from of medical. Side effects and dangers of Moderna vaccine. Some of the side effects that can occur after receiving the Moderna vaccine are pain, swelling, or redness at the injection site, and fatigue, heat sweat, muscular ache, joint pain, shivering, nausea, and vomiting fever. The Pfizer vaccine is an or messenger RNA vaccine. This type of vaccine will trigger the immune system to form spike proteins, which will later help the body form antibodies that can fight coronavirus. Based on phase 3 clinical trials conducted in the United States, Germany, Turkey, South Africa, Brazil, and Argentina. The Pfizer vaccine has a efficacy found, namely a protective effect against COVID-19 of 95%. What is the Pfizer vaccine? Group prescriptive drugs category COVID-19 vaccine benefit preventing COVID-19 or SARS-CoV-2 virus infection used by adults and children over 12 years of age. Pfizer vaccine from pregnant and lactating women. Pfizer vaccine can be given to pregnant and lactating women. For pregnant women, the application can be start from gestational age of over 12 weeks and no later than 30, 33 weeks of gestation from of origination. Pfizer vaccine side effects and hazards. Some of the side effects that can occur after using the Pfizer vaccine are pain, redness, or swelling at the injection site, heat, itch, muscle pain or joint pain, shivering, mild fever, nausea, or feeling unwell, swelling in the lymph nodes. The AstraZeneca vaccine is derived from a genetically modified virus or viral vector. This vaccine works by stimulating or triggering the body to form antibodies that can fight infection with the SARS-CoV-2 virus. AstraZeneca vaccine for COVID-19 is undergoing clinical trials in the UK, Brazil, and South Africa. This vaccine has a effective health or protective effects against COVID-19 of 63.9%. AstraZeneca vaccine effect. Pain, warm, itching, or bruising at the injured site. Heat, body feel tight, muscle and joint pain, fever, diarrhea, shivering, flu. That's all from me. The explanation about the COVID-19 vaccine. Sorry if there are words or sounds that are not clear. Please forgive and thank you.